so I'm washing my hands. Hi, I'm Kira. I'm the nurse practitioner here to do physical exams. What brought you in today? Just a physical?
Yes, just I need a physical for work.
Okay, perfect. What time was your appointment?
It is at 11 a.m.
Okay, and where did you park?
I parked in the facilities parking lot downstairs.
Okay, did you have trouble finding the place?
Nope, I didn't.
Great. Okay, so based off of that, appears the apparent age, sexual development's appropriate for her age, good posture, well-groomed, good hygiene. Facial features are symmetric, good full head of hair. Can you smile for me and frown? Puff out your cheeks and then show me your teeth. Perfect. Okay, so cranial nerve 7 is intact. And then speech and level of consciousness is intact as well. And so then just gonna look at the skin color, which is appropriate for ethnicity, and then wearing gloves. I'm just gonna pretend to feel your scalp, make sure there's no masses, no lesions, any discomfort there.
No, feels good.
Perfect. Okay. And then what I'm going to do is I'm just going to test cranial nerve 5. So I'm gonna place my fingers kind of like along your jawbone here. So open your mouth for me and close. And kind of move the jaw around. Perfect. Okay, so I don't feel any crepitus, feeling for TMJ, I don't feel it. And then I'm going to test the sensory, so close your eyes. I'll test the left side or the right side, just tell me which side I'm touching.
My left side.
Good.
My right side.
Perfect. So then cranial nerve 5 is intact. And now I will feel your temporal arteries here. Any discomfort?
No.
All right, perfect. You can open your eyes. Great. So then moving on to the neck, we'll test the range of motion. So I'll just have you look down and then look up. Look to one side, touch your shoulder with your chin. Good. And then the other side, do the same thing. Perfect. So full range of motion. And then I'm just going to touch your neck right here. You can move your neck around again. All right, perfect. So there's no crepitus felt there either. Trachea is midline. And now what I'm going to do is I'm going to place my hand on either side of the face. And I want you to kind of like push against my hand. So push.
Okay.
Good. And then this side. Perfect. And then I'm just going to touch your shoulders here and just rub up against them. Perfect. So cranial nerve 11 is intact. And now we're going to go on to the lymph nodes. So we have the preauricular back here or up front. And then we have the posterior auricular. And then we have the occipital back here. Superficial cervical, posterior cervical, tonsillar, submandibular, and submental. And then we have the supraclavicular. You can shrug up against me again. Any discomfort?
No, feels fine.
Okay, perfect. And then after that, we're going to go on to the eyes. So if I had like the Snellen chart, I would show you, and then you would read the smallest line covering one eye, and then do the same on the other side, and then we could see how good your vision is. But since I don't have that, we'll just pretend, and then we would move on. So I'm going to show you this pen. I just want you to follow this object with your eyes. Perfect. So cranial nerves 3, 4, and 6 are intact. I'll have you look back at the TV there, and then look back here. Good. So cranial nerves 2, 3, and 4 are intact. And then I would pretend this is a pen light, but since it's not, I will just pretend. So I'm just going to check for your pupil reflexes. So just shine a light in your eyes. Good. So good pupillary reflex. So cranial nerves 2 and 3 are intact. And then I would shine this like right in the center of your face, and it looks like the corneal light reflexes symmetrically. Look at the junctiva, it's pink and moist. The sclera is white. I don't see your lid lag. Can you close your eyes for me? Perfect. So there's no edema, no erythema. Limbal margins are clear. Looking at the epicanthal folds, you can open your eyes. And then I'm just going to feel your eyebrows here. Full eyebrows. Any discomfort?
No.
And then I'll feel your like tear ducts here. Any discomfort?
No.
Okay. Perfect. So everything seems to be intact there as well. And then we'll go on to the ears. So I'll do a whisper test. And just because the setup is a little difficult, if we were in like the lab, then I would kind of stand behind you and I would whisper on both sides and make sure you can hear me. And then if she could hear me, then cranial nerve 8 is intact. And then I would look at the ears, and they look perfect. Thank you. Symmetric. No abnormalities. So I'll just feel the tragus and the aureus. Is there any discomfort?
No.
Perfect. All right. Everything is intact here as well. And then you would do the otoscopic exam here in the lab. So then we'll go on to the nose. So nose looks appropriate. It's midline. If this was a light, I would be looking up your nose, sorry. So nasal mucosa is pink, moist. I don't see any lesions or anything. Nasal septum is there, just midline. And then I would take some object, like if I had a candle or something, I would have you close your eyes, and then I would just put it underneath you, make sure you can smell. And if she can smell, then cranial nerve 1 is intact. And then I would close each nostril, and then make sure everything's okay. The nasal pathways are patent. And then I'll feel your frontal sinuses up here, and then your maxillary sinuses. Any discomfort?
No.
Okay, perfect. So then we're going to go on to the mouth. So the lips are pink and moist. Can you open your mouth for me? Okay, good. Can you lift up your tongue? Perfect. So looking at the hard and soft palate. The teeth are present, no signs of decay. The gums are pink and moist. And then sensitive Wharton's ducts are present. So if this was a tongue depressor, I would just test the strength of your tongue. You would just press against either side of this. And then I would test your swallowability. Go ahead and swallow. Good. So cranial nerves 9, 10, and 12 are all intact. And then after that, we would go on to the, let's see, what would we do? We would do the lungs. So just based off of inspection, skin is appropriate for your ethnicity, the shape of the thorax is fine, there's no labored breathing. And then I would kind of go behind you. And then I would just feel back here, take a deep breath for me. Perfect. So expansion is symmetric. I'm just going to feel along your spine here. Any discomfort? No. Okay. We're looking at the costal angle here on the sides posteriorly. And then we would be sure to measure the AP to transverse diameter back here. And then I'm just going to do like a light tap on each side of your back here. Just tell me if there's any pain, okay?
Okay.
Any pain?
No pain.
Perfect. So no CVA tenderness. And then we would percuss. So I'm just going to do the back first. 4 different places back here. Sorry if my hands are cold. And then if you could raise your right arm for me. Perfect. Do the right middle lobe back here. All right, great. So resonance is heard throughout. You can lower your arm. Thank you. And then I'm going to be listening to the places that I just tapped. And every time I place my stethoscope down, just take a deep breath, okay? Okay. And then raise your right arm for me again. Thank you. Perfect. You can lower your arm. So I hear resonance throughout the lung fields posteriorly, and now I'm going to listen to the front, just in 4 different spots. And again, just take a deep breath. Okay. Thank you. So again, I hear resonance throughout all lung fields bilaterally. There's no adventitious lung sounds heard. And now what we're going to do is move on to the heart. So I'm going to get up, and then I'll just have you lay down. Okay. However you're comfortable. Perfect. Okay. So I'd be looking with the light. I'd be looking for, I'm just going to move your hair if that's okay. Thank you. That's okay. So I'd be looking for JVD, just jugular venous distension with the light, which I don't see from this angle. And I would be looking at the precordium up here. I don't see any bounds, heaves, or lifts. And then we'll be looking at the PMI, which is typically the 5th intercostal space. And then after that, I would feel, so I'm just going to feel the carotid pulses, just one at a time. And for this side. Good. And then I would take, if I had it, 2 rollers to measure JVG if it was present. And then I would feel the precordium up here. And then we'd feel the PMI down here. And then for the lung sounds, for the heart sounds, we have the aortic over here, pulmonic, Erb's point, tricuspid, and mitral. And then I'm going to listen to some spots again, and you can just breathe normally.
Okay.
Okay, perfect. And then if we were in a different setting, I would just ask her to move up the shirt so I could listen a bit better. And then I'll just listen with the bell over the carotid pulses to make sure I don't hear any bruit.
Mm-hmm.
Perfect, so there's no bruit heard. And then what I would do is I'm just going to check all of your pulses while you're laying down. So we have the brachial pulses here. And then we have the radial pulses. Good. And we have the femoral pulses down here. The popliteal pulses behind the knee. Posterior tibialis down here. And then the dorsalis pedis on top of her feet, which you can't see, but they're on top of her feet. And then I will be looking at the upper and lower extremities. So I'm just gonna, can I see your fingernail really quick? Thank you. So there's good cap refill. And I'll do the same thing on your toes. Good cap refill. It looks like her legs are shaved, but on the arms there is even hair distribution. Skin color is appropriate. It's warm to touch. There's no edema, no erythema, no viscosities seen. So everything looks good here. And then we'll go on to the musculoskeletal, so we'll do range of motion. So what I'll have you do is spread out your fingers like this. Perfect. And I'm just going to kind of wiggle them around. So any discomfort here?
No.
Perfect. And then I'm going to try to squeeze your fingers closed. Don't let me do it. Good. And now I'm going to hold on to your wrist. Just make circular motions. Good. And the other way. Perfect. And then we'll do the shoulders when you sit up. But since you're still laying down, we'll do the ankles.
Mm-hmm.
So we'll make circular motions here. Perfect. And then push down against my feet. Against my hands. And then push back. Good. And then with your legs, I want you to push up against my hand. Good. And this one. Perfect. And now just kind of bend your knees. You're going to move your knees around, make sure you have good range of motion.
Mm-hmm.
Good. And then lift your legs up for me. Perfect. And now we're going to move your hips for the hip range of motion.
Mm-hmm.
So you can kind of move it like an outward way, as if you're doing like a stretch. Good. You can do the other side. Perfect. I don't feel any crepitus anywhere. Good. You can relax. And then you can sit up actually now.
Mm-hmm.
Thank you. And now what I'm going to have you do is use your arms and make circles. Good. And then go back. And then push up against me. Perfect. So good full range of motion over here. 5 out of 5 strength. And because I almost forgot, I'm going to have you lay back down. So sorry for the inconvenience. We're going to be looking at the abdomen. Make sure everything looks good there. So skin is appropriate for ethnicity. Contour is flat. I don't see any aortic pulsations. And then I'd be looking with the light. I don't see any aortic pulsations here. Everything is good. So before I touch or do anything else, I'm going to listen. Just breathe normally.
Mm-hmm.
Okay, so bowel sounds are active in all 4 quadrants. And now I'm going to listen to the abdominal aorta to see if I can hear any bruit. All right, which I don't hear, so everything sounds good. And now what I'm going to do is percuss, so I'll just lightly tap over your stomach. Any discomfort?
No.
Okay, so your tympani throughout, and now I'm just gonna lightly palpate. Sorry, my hands are cold.
That's okay.
Any discomfort?
No.
Okay, now I'm gonna do it a little bit harder to look for organomegaly. Any discomfort?
No.
All right, perfect. So no organomegaly. Everything sounds great. Now you can sit up again. Thank you. And now what I'm going to do is, before I test the spine range of motion, I'm just going to ask you some questions. So we're going to do like a neurological exam, which I kind of had already done earlier, which everything seemed intact before, dressed as appropriate. I'm going to give you 3 words that I want you to remember, okay?
Okay.
Dog, book, orange.
Okay.
So remember that. How do you spell cat backwards?
TAC.
Perfect. And then if there was an ambulance driving towards you, what would you do?
Pull over.
Perfect. Yeah, great. And what were those 3 words that I told you?
Dog, book, orange.
Perfect. Yes. So thought processes are logical and clear. Memory is intact. Again, everything is appropriate. Neurological and mental status is completely intact. And so now what I'm going to have you do is you can stand up.
Okay.
And then I want you to reach forward for your feet. Good. And then lean back.
Okay.
And then kind of twist your body side to side. Okay, so full range of motion is intact. And there might have been some mild crepitus with the back cracking. So then what I'll have you do is walk that way a little bit and then walk back. Okay, just because that's perfect. And then you can walk back. Great. So ambulates perfectly well. Balanced gait, it's very steady, coordinated. And so now what I'm going to have you do, we'll do the Romberg test. So I want you to just lift your arms up like this, close your eyes, and then count to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Perfect. Great. So now you can open your eyes, and then you can sit back down if you'd like. And then what I'm going to do is you can close your eyes, hold out a hand for me, and I'm going to draw a number in your hand. Just tell me which number it is.
1.
Perfect. Yep. And now you can open your eyes. And then I'm going to take this same cotton ball that I had earlier, and I'll touch the face, arms, or legs. Just tell me which side I'm touching. Okay. You can close your eyes.
Okay. My left cheek.
Mm-hmm.
My right cheek. My left arm. My right arm.
Mm-hmm.
My left leg. My right leg.
Perfect. So sensory is also completely intact. And then if I had like a deep tendon reflex hammer, then I would check your reflexes. I don't have it, so we'll just pretend. But I would check your brachial on both sides, and then I'll check your knee on both sides. And then everything would be intact. So I believe that concludes the self-assessment. Thank you very much.
Thank you.
Well done.